I was born with cerebral palsy, and it kind of was a progressive thing, so my mobility was getting less as I moved into adulthood. I've done some therapy and things, but nothing to really address it. But it had gotten to the point where that wasn't going to work out. It was almost like I could hardly walk across a room.
He was left with an ankle that he basically couldn't bear weight on. He had far different expectations from a lot of patients that are considering amputation surgery. His biggest complaint was that he couldn't bear weight long enough to be able to hold his baby girl.
I had a couple doctors look at it, and then through my sister, I met Aaron Fitzsimmons, and he got me in touch with Dr. Falk and looked at the ETRL procedure.
Well, we felt he was a good candidate for an ETRL operation, mainly to give him something he could end weight bear on. Because of his cerebral palsy, it's left him with a lot of difficulty walking in general, even if he didn't have the problems with his ankles.
Based on their opinions, I decided to go ahead and have the amputation of the lower right leg.
We'll put patients through multiple operations to avoid amputation, but at some point amputation was probably a better solution, and I have patients that tell me that every day. The difference that we have here at the surgical clinic is that we have vascular surgeons that work hand in hand with prosthetics. They're able to take each patient individually and tailor the prosthetic and the surgery as needed to that patient.
Since I've had the procedure done, I can do things with my family that I couldn't do before. There would have been no way. We went to Chimney Rock for a vacation. It's 500 steps up, it's 500 steps down. I would have passed that up, I would have looked at it and said, wow, that would be nice. I wonder what it would be like to go up there. This year, I went up there. I can get down on the floor and play with my daughter, carry her on my back, things like that, that anybody would think is just a normal thing that wouldn't have been possible for me before the operation.